Hello and welcome everyone to Riverside Live Studios. Thank you for joining your Ageless Musical Brain podcast. My name is Lucelena Blanco, Lucy, and this is the show in sync with music and brain health. Don't forget to subscribe and stick around for a very pleasant surprise we have exclusively for you, our audiences, today. My guest is clinical musicologist, one of the very few we have in the world. She is the founder of Surgical Serenity Solutions, helping hospitals and medical facilities that offer surgery, increase patient satisfaction, reduce anxiety and pain perception. Welcome to the founder of Surgical Serenity Solutions, Dr. Alice Cash. Welcome, Doctor.
Thank you so much, Lucy. It is such a pleasure to be here today and to let people understand what music can do for the brain during surgery and before and after. So I'm ready to hear your questions.
So let's get started with the game-changing world in which you are a big part of in the music medicine, and how the art of music helps reduce anxiety and pain in music medicine. Doctor, I know that you have been a clinical musicologist for many years. What got you started as a clinical musicologist?
That's a great question. I had just gotten my PhD in musicology in 1990. And originally I was studying more traditional musicology, which is research into music. But around 1990, I had the opportunity to meet two very important people that changed the course of my life, really. One was a man named Don Campbell, and the other was a man named Dr. Arthur Harvey. And they were all about music in the brain. Even then, this was late, and I heard them speak, and I read their books, and I made an appointment with Dr. Harvey. And he actually was at the University of Louisville, where I am, University of Louisville, and he said, Dr. Cash, I'm going to tell you something that nobody knows but you. And that is that I have just accepted a job at the University of Hawaii. And I really would like to take that job. And I would like to recommend you to take my place at the Arts and Medicine program at the University of Louisville. So I was shocked, thrilled, honored. And through several different more interviews, I got the job at the University of Louisville. And my mentor there was a psychiatrist, and he said, we need to get you a clinical degree. So I decided to go for the social work, and a master's in social work. I already had bachelor's and master's in piano performance and a PhD in musicology. Then I got a master's in clinical social work. And so at that point, that's when I became a clinical musicologist.
Awesome. Tell us about rhythmic entrainment. I'm very intrigued, and how it works in our psychophysiological response to pain, fear, and anxiety.
Okay. That could be a very long answer, but I will try to be as concise as possible. First of all, rhythmic entrainment is what happens when you hear a slow, steady beat in your environment, and your body automatically synchronizes with that pulse. So when you go to a concert and you hear music and you start clapping, or you hear music on the radio or the TV and you start tapping your foot and, you just can't keep still, that is rhythmic entrainment.
And that works in the brain as well.
When it works the whole body. I mean, it starts in the brain, but it fills the body with rhythm. And it can be fast, it can be slow, it can be medium. But the idea is when you put music in someone's environment, and especially through headphones, then their body is going to entrain. I mean, it's totally involuntary. You have nothing to say about it. Your body just starts synchronizing with that pulse. So in the case of surgery and pain management, the music comes directly into the brain through the 8th cranial nerve.
Right.
and the body rhythms that we all have, breathing, heart rate, blood pressure, they begin to entrain with that pulse of the healthy resting heartbeat, stabilize and stay. It helps the patient to stay stabilized with body rhythms, breathing and heart rate and blood pressure through a procedure like surgery or like childbirth or with pain management specifically. That's where the entrainment is just going to help more, distracting the patient from thinking about, oh, my back is killing me, my neck is killing me, knees, whatever, wherever the source of the pain is. Having music coming into the brain through headphones is going to help ease the muscle tension, because that's what music does, is help the muscles relax. And when you're experiencing chronic pain, your muscles are just in knots all the time. And you're thinking about how much it hurts and what can you do.
Wow. And what I find fascinating also is how it helps control the vital signs or bring it to the healthy level it's supposed to.
Right. Homeostasis.
What about the future of technology? We have a bright future in music medicine. Tell us about the advancements in artificial intelligence technology in relation to music medicine.
Well, artificial intelligence is taking off in terms of algorithms that tap into the patient's body rhythms. And so there are companies now that are creating music for patients. Now, Surgical Serenity Solutions does not do that. Our music, classical music, jazz, new age, lullabies, and memory care music. So we use acoustic music that's been around for a long time. The AI world is very interesting, though. The way it's marketing itself, I mean, it's going to be a game changer, but I don't think traditional acoustic music is ever going to go away that was written by humans, if that's what you mean.
And what about what happens before, during, and after surgery, doctor? The Mayo Clinic and the Cleveland Clinic, for example, just to name a few reputable hospitals, they have studied and researched your headsets to be proven effective. Tell us about that, doctor.
Well, that's very exciting. And in addition to Cleveland Clinic and Mayo, Johns Hopkins, the VA hospital system has been a huge proponent of my headphones. And the study that was done at the VA hospitals, the study was done on men undergoing major abdominal surgery. And one of the things they were looking at was whether or not the music that we have coming through headphones could reduce the amount of opioids required. Because today, as you know, we have an opioid epidemic. And it's all over the country, but it's especially in Kentucky and Tennessee and West Virginia, Ohio. And if there's any way we could reduce that, because people start out innocently having surgery and they have to have pain medicine. If you're going to be cut into, you've got to have pain medicine. But what they found was when they were listening to our music through headphones, they needed less opioids. They needed less pain medication. And after the surgery, when they're in the recovery room, that's also when people begin to experience a lot of pain. But when they were wearing our headphones, listening to our music that had engaged rhythmic entrainment, they required a significantly less amount of opioids. And that's huge.
Yeah. Doctor, this is a huge breakthrough, because for a person who's about to, say, go to the dentist, right? Or they know that they're going to have, for example, knee surgery, where they know they have to be awake, right? And they're told that they're going to be, of course, under anesthesia. It still creates a lot of fear, anticipated fear. So that concept of the fear, or that anticipation of the fear, affects the human body, and it can have long-term negative lasting effects. So your headsets actually provide a solution, right, to actually prevent the decline of poor health and even create chronic diseases, because all of this, right, is what it leads to when we don't have music to actually calm us down. Every time we get stressed, right, the bad hormones that we have in our bodies when we get stressed.
Cortisol. Yes.
Yes, right.
And many of the music medicine studies refer to cortisol levels, and they measure the cortisol level, which is the stress hormone. But it's interesting that you're talking about the use in fear and chronic pain. I have a conference call right after this with a young man from a VA hospital in Phoenix, and he just did his PhD dissertation on my headphones and
Wow.
whether or not they could reduce the amount of PRN medications that severely agitated patients were having in the behavioral health section of the hospital. So people who are agitated typically are given Valium or Xanax or anti-anxiety drugs, but they're very, very addictive. And
Right.
so his study was looking at when a patient becomes agitated, if we give them the headphones with the classical, jazz, new age, lullabies, or memory care music, could that greatly reduce the amount of anxiety medication that they need? And he found that yes, it can. So we're getting ready to talk to him in just a few hours about his study, and he's going to be presenting it at the American Psychiatric Nursing Association conference, which is going to be right here in Louisville, Kentucky in October. So I will go. And I wanted to mention, Lucy, if you don't
Yes,
mind,
of
we
course.
also have a new product. And in addition to the headphones now, we have little MP3 players, and
Really?
each one is loaded with one of our 5 playlists, comes with earbuds, and can be co-branded for hospitals. So you can get 4 or 5 of those for the same price as one headset, because the headsets are intended to be reused by hospitals. But
Right.
the MP3 players are actually so cost effective that they're intended to be given to the patient after surgery or after childbirth or after chemotherapy, after kidney dialysis. And that's all the areas of the hospital now that are using our music. It's not just for surgery anymore,
Right,
but for
exactly.
any painful medical or dental procedure, as you said.
Right. Not only that, doctor, this is very, very interesting. And also for patients that have Alzheimer's.
Yes, because one of the things that happens with Alzheimer's is people's world begin to close in terms of familiarity, and one day you don't recognize your husband or you don't recognize your children, and you have no idea what year it is or where you are. You don't recognize your own home. And so what we found was when we give Alzheimer's patients music from their courting years,
Right.
the years when they were falling in love and they had all of these strong positive hormones coursing through their body, for some reason, to the very end of their life, Alzheimer's patients can still hear familiar music and respond to it. People who never say a word, they sit in a wheelchair all day long just staring into space. You put on Tiptoe Through the Tulips or Ain't She Sweet or some of those songs from their youth, and their eyes light up. And sometimes they will start talking about that music and what it means to them or, in training to it.
Right. Yeah.
And in the study, I did a study on music with Alzheimer's patients. And what it showed was it had about 30 to 60-minute positive effect. I mean, it's not going to cure Alzheimer's. It's not going to turn back the clock,
Right.
but it will give that person one time during the day when they can actually experience pleasure and remember their old selves, and they eat better, they sleep better, they're less agitated. It's kind of a miracle.
Yeah. And you know what it is too? The family members and everyone that's around them that actually witness the
Yes,
change, the transformation in their
right.
mood, right? It helps a lot, right? For the caregivers, right? To
Yes,
see how they
respond.
improve and reduce their risk of falling more and more into depression.
Yes, absolutely. I mean, if we could just get the word out about the power of music with Alzheimer's patients, and I do think it's been coming out for a while now. Anybody that subscribes to AARP definitely knows all about it. But remember the movie that came out called Awakenings?
Yes.
And it was about Dr. Oliver Sacks and all of his
Yes.
work with not only Alzheimer's but mentally ill people and how music played such a huge role.
Right. And I think it's because it's taken many, many years for music to quote unquote marry the medical field.
You know, in modern times, yes, but music actually has been an ancient intervention for the
Oh,
beginning time.
yeah,
The music of
absolutely.
nature, for example, wind through the trees and babbling brooks and bird songs, all of that, early humans knew that that
Right.
soothed, calmed them down.
Yeah, absolutely, absolutely. It's just that in the fast-paced world that we live in, it's something that is overlooked. People don't pay attention to it. People still think about music as, okay, I'm going to listen to it for enjoyment. But what about listening to it while you are under stress and
Right.
fear?
That's where AirPods, you see people out on the street everywhere with AirPods in. And I think
Right.
some of that, of course, some of them are talking on the phone, but hopefully some of them are also listening to soothing music because that helps slow you down.
Yeah.
If you're racing around, you put your AirPods in and put on one of our playlists, you have to slow down
Yeah.
because you can't help but entrain to that music.
Right. You give in to the music, especially when you're about to go into surgery. Doctor, there are different industries that have already experienced the benefits of your preloaded headsets, right?
Well, I mean, hospitals being the biggest ones,
Yeah.
but I've had dentists to get the headphones. When I first had this idea back in 2005, my ideal patient was going to be plastic surgery
Hmm.
because I figure in plastic surgery spas around the country in New York and Beverly Hills and Miami Beach, patients want the latest thing. They know that insurance isn't going to pay for it, and they have disposable income usually. But I tried to make something that would not cost an arm and a leg, and I feel like I've been successful. I mean, I was talking to a man yesterday who's invented something for hospitals that, well, I don't want to say too much about it, but it's much more expensive than mine. I mean,
Right.
mine can be bought by the patient. If the hospital you're going to doesn't have these headphones, the patient can buy their own. They're
Right.
$250. And or my 5 playlists are in the Apple App Store and the Google Play Store.
Right. Oh,
So you
wow.
can
That's
download one
terrific.
of the playlists, take it to the dentist with you. That's what I'm going to be doing on Monday. I get a
Right.
crown, and I will definitely have my AirPods, my iPhone, and my classical playlist. And that will get me through the procedure.
And doctor, tell us, at the moment the individual using the headsets is about to say, go to the dentist, for example, they're able to hear the dentist talking to them, right? That's
Right.
the benefit. Is that correct?
Yeah,
Even for
absolutely.
surgery when they have to be awake.
Right. Because, I mean, surgery has different kinds of anesthesia, just like dental work does. And sometimes you are sedated, but you're
Right.
not knocked out. But when you're sedated, part of that is because they do need to talk to you. And like at the dentist, they need to say, okay, bite down and squiggle and ask you questions. So you can easily hear what the dentist says. And if not, you just lift one headset, half an inch, and you can clearly hear what they're saying.
Right, exactly.
But it
Uh,
helps to mute that horrible drill, which
oh,
everybody just tightens up when they hear that, sees a drill coming to their
yeah,
face. It's
oh my
like,
goodness, yes. So exactly, that sound, right?
yes,
That sound that we are familiar with changes to the pleasant sound that
soothing music.
just take us away from that situation, take us
Right.
away from focusing on that fear. Yeah. And doctor, give us top reasons to give patients specific headphones during medical procedures.
The preloaded headphones, first of all, are so much better than a corded headphone. So, because you don't want anything that's going to tangle with the surgeon's, equipment. They're using lasers themselves. So
Right.
having the preloaded headphones, the music is already on there. And first of all, it's going to calm down the patient because they'll have that steady pulse that their body will entrain with.
Right.
Then, when they use less medication, they recover faster. And some patients are extremely sensitive to anesthesia and to pain medication. So the less they can have, the better.
Right.
And older patients, especially, sometimes they have trouble waking them up because they
Really?
go so deep so quickly. So if you're giving them music, you don't, the anesthesiologist can monitor how deeply sedated they are. There's a monitor called a BIS monitor looking at that. And when the patient gets to the ideal level of sedation, then they slow that anesthesia way down, and the music alone is getting them through it.
Wow, that's
So fewer side effects. One sort of unexpected benefit that I've run across now several times is that sometimes during surgery, the medical staff is having a conversation about what they had for lunch or what they saw at the movie the night before. And I mean, they may be doing the surgery, but they're still talking about something different. And the patient really does not need to hear that. And every now and then, a patient will wake up who didn't have the headphones and say, I could have sworn I heard the doctor say, this is worse than we thought.
oh, almost.
And you do not want to hear that sort of comment. So having the headphones on will block those extraneous comments, block all the beeps and blips of the machine,
Yeah.
and let you relax and enjoy the music and let the doctors do what they need.
Right. That's detrimental. Because then
Yes,
after that, who wants surgery, right? So you can very easily make the choice. No, I'm not going to have surgery because I relate it, of course, to pain.
right, right. And people are afraid they won't wake up. People are really
That's
afraid
another
of
thing too,
general
yes.
anesthesia
Right.
because they've heard, I mean, every now and then a patient does not wake up, and usually they had a heart condition or, some sort of lung condition that caused that.
Yeah.
Nowadays, surgery is pretty safe. It really is. But having the headphones is just a way to increase patient satisfaction and patient safety
Mm.
and enjoyment, actually.
Right. It provides the solution. Yeah. And that's a huge breakthrough. It makes such a big difference in many people's lives, and not only the Alzheimer's that we were talking about, but also patients or people that have Parkinson's.
Yes, where rhythm
Any
is so
kind of
important.
chronic, right, doctor? Any kind of chronic condition that, of course, takes the person naturally in a path that they don't want to go through, and family members don't want to see them go there, which is deeper depression. That, of course, affects our whole system.
Right, right.
You
It
know?
absolutely does. So I think behavioral health or
Yes.
psychiatry is going to be one of the big uses going forward for this music and for the headphones.
Yeah.
Because, traditionally, hospitals and psych units have music therapists, but this is different. This is not
Yeah.
music therapy. This is music medicine. With music therapy, the therapist is meeting with the patient one-on-one
Right.
and establishing a relationship and getting to know that person's needs and setting goals with them that will be accomplished by music therapy. Music medicine is not the same at all. In music medicine, we are prescribing therapeutic music for specific situations like surgery or like chemotherapy, like kidney dialysis, like dentistry. And the patient gets the choice of the genre. Now, with
Right.
music therapy, it can be much more tailored. If you want to hear Taylor Swift, okay, or Elton John or Bach. But with music medicine, you get to choose the genre, but not the specific piece. And the need is different. With music therapy, you can have songs and sing happy things or familiar, comforting things. With music medicine, you are providing music that's usually purely instrumental, and
Right.
it has the slow and steady beat, and it's for a whole different purpose. It's not entertainment. That's one of the things I've said many times, and if you've read this article on LinkedIn I wrote,
Right.
entrainment, not entertainment.
Right.
Because
Yes.
sometimes I will write something about rhythmic entrainment, and people say, "Oh, don't you mean entertainment?" No, it's a totally different thing.
Because it has to do with you, with your physiology, with your, right, not only with your
Yes,
psychology but also your vital signs, right,
right.
and
Yeah.
how it helps you maintain a healthier state of mind, which in turn, of course, affects the body in a positive way. And doctor, as the founder of Surgical Serenity Solutions, there is a link. Would you like to share that link?
Yes. I wanted to
Yes.
give everyone who has attended our seminar today a report that I wrote about using music to boost your energy and to increase your wellness level, and basically how music affects the mind-body continuum. So that link is www.surgicalserenitysolutions.com/boost, and that'll take you there. But you have kindly put this in the chat, this link.
Yes, I put it in the chat already. Yes, doctor.
So people can just click on that. And all I ask is that you give me your email. And if you don't want to be on my mailing list, you can jump right off as soon as you get the report. But if you do want to be on it, I send out an e-zine once or twice a month about my latest developments for music medicine and music in the hospital, and getting the headphones or the MP3 players in the hands of every hospital patient.
This is indeed a real serenity solution. Doctor, I love it. And a lot of people I know that are watching this show and also listening to it on the Your Ageless Musical Brain podcast audio will definitely benefit from all the information that you share with us. And this is just the beginning. It's like you're nonstop, right? You're not going to retire, doctor. This is like going to go on for many, many years, and I'm so happy, to have this opportunity to share this information with the audience. You, as the founder of Surgical Solutions, make such a big difference in people's lives by using music. It's amazing.
Thank you.
Doctor, thank you so very much. I want to thank all of our audience for tuning in today, and don't miss other episodes of Your Ageless Musical Brain Live YouTube channel. Thank you so much, Doctor.
My pleasure. Thank you so much for having me here. I just love every opportunity to get my message out. So thank you.
Absolutely. Definitely, to educate everyone and change a lot of people's lives, one person at a time, when they are feeling fear and anxiety in events such as surgery, dental care, or any other type of fearful experiences that even go beyond the medical field. Thank you so much, Doctor.
You're welcome.
It's a pleasure. Thank you so much.
Okay.